Hello, everyone. Today we are having this episode, an interview with Dr. Sahar Barayan. I'm gonna reach out to her and invite her to join me. Um, Today we will be joining with Dr. Sahar in a bit. I'm gonna go ahead and invite her. Okay, I invited her. I'm gonna share this with my pages. We're gonna start around 8 o'clock. I'm gonna message her very quick. So the purpose of this project, or the focus of this project is, or this series, is to promote wellness and provide, let me just approve of her. To add her is to provide, or to promote wellness and to provide examples from the guests on the show of confidence, from their real life experiences, and from their professional experiences. Let me see if she's able to be on the show. Let's see. I would like to also mention that these lives and interviews, they will go throughout August, either daily or after every other day, and they are not meant to be to replace medical or professional help. They are meant for general info. If I can add her now. Hello.
Hi, Rabah. How are
Hi,
you?
how are you?
Fine.
Thank you for joining me.
Of course. How have you been?
I'm good. It's so good to see you.
Same here.
After all of this time.
I
So
thank you
we're
for
gonna
inviting me to be part of your show or part of your interview.
Oh, thank you. Thank you for joining me. I thought it's an important opportunity to promote this wellness to the audience and give tips on confidence and wellness throughout the month of August before back to school day.
Wonderful. And
Yeah.
actually, I want to thank your followers because I've been getting a lot of friends requests. So I'm making
Oh,
friends
okay.
even without being on the screen yet.
That's good. I'm glad. So we're gonna give it 2 more minutes to start, and I will be sharing it with my other page. Um, and for people who are watching us, please feel free to watch and to comment, to tell us where are you joining us from. You can put comments in the comment section, and we will be happy to respond to your comments and questions. And share. You can like and share that show with your network. Okay, so we're gonna start. I want to also start again saying that this a disclaimer that these interviews or these lives are meant for general info only. They're not meant to replace any professional help or any medical help. So just I wanted to note that that's important. So
I
we
just
will.
want to say hello to my friends, Terry and Marwa. Thank you for joining.
Thank you everyone for joining. Yes, I will keep an eye, Sahar, on the comments here, just in case someone wants to, they're asking questions or putting comments, so you can just, um, can, yeah. So again, thank you for joining me, and our friendship goes way back to Saudi Arabia.
22 years.
Yeah, so I didn't introduce you. So Dr. Sahar Barayan, she is the medical director of pediatric nephrology and past chief of staff at Valley Children's Hospital. Usually that term is 2 years, Sahar, you said, isn't so?
That's correct.
Yeah, yeah. And so she is in California and she's joining us. Yeah. Thank you for joining us. So tell us more about what you do and how long have you been in this career, Sahar?
Okay, so I finished medical school from Saudi Arabia in 1988, and I was determined at that time. I knew I wanted to come to the States for my postgraduate studies.
Mm-hmm.
So I passed the American exams, and I went to Georgetown University in Washington, D.C., completed my pediatric residency training, and I was on an exchange student visa, so I have to go back to my country and practice there before I, come back. When I went back to Saudi Arabia, I realized that there weren't any pediatric nephrologists in the area I was in. And all of these children that required dialysis, we didn't have the services for them, so they died. So I decided to come back to the States and get my training in pediatric nephrology. And I went to UCLA for my fellowship, finished my training in 1999, went back to Saudi Arabia for 5 years and then moved back to the States. Initially, I was in Virginia for 3 years and then I moved to Fresno. And I've been here for 11 years now at Valley Children's Hospital. I'm currently the medical director of pediatric nephrology, but I always aspired to be in leadership positions. Mm-hmm. So I was the chair of the Department of Medicine for 3 years. Then I was nominated to be the vice chief of staff and then the chief of staff. During that time, I finished my master's degree in medical management from USC, and I'm ready for my next move.
Wow, wonderful. So collectively, how many years have you been in this career?
Well, people are gonna start calculating my age, Rabab. I've been in
this.
Oh,
okay. So
no, I've been in this career for 30 years now.
Wow, that's wonderful. That's wonderful.
I
so
finished my.
let's give that before for those who just join us. I'm having an interview with Dr. Sahar Barayan. Again, she is the medical director of pediatric nephrology and past chief of staff at the Valley Children Hospital in California. So let's give the audience some context about, I was raised in Saudi Arabia, you were raised in Saudi Arabia, so there are certain contexts we need to give the audience about living in Saudi Arabia and how different that is from being in the United States, and what a cultural shock we will have to endure in the beginning and for quite some time, starting with driving a car.
Yeah, so if as many people would know that living in Saudi Arabia is a very enclosed culture. So women there are very overprotected. So actually we don't drive cars, we don't go shopping, we cannot leave the country without guardianship, we cannot start work without, a male guardian. Absolutely. And so forth. So coming from that very restricted society to the United States, big place where you can do anything and you see different things, was a little bit difficult in the beginning. I think the most difficult part is driving. That was my first time driving. I also had my children during my residency. So I was in training, I was a new mother, I was a wife. So I was fighting in different, battles.
Yeah. And plus the cultural battle. Don't forget that the language barrier, the culture, everything is different.
I can tell you funny stories about what happened to me when I first came, but let's just skip that because it's really embarrassing now when I remember how I think.
Well, if you're comfortable, you can share it with us.
Okay, so one time we had a 15-year-old patient coming into the hospital at night, and she came in with vomiting. So I was presenting her in the morning report. So the chief resident asked me, "Did you do a pregnancy test?" And I told her, "She's not married." The whole room exploded in laughter. It's to me, having
it's the cultural thing.
Completely different. Yeah.
Yeah, I totally understand. So this interview is part of the series of 30 days of confidence, and we want to correlate or point out how confidence has a big role in your advancement, whether in career or being here in the US and acclimated with the whole environment professionally and personally.
Well, I could not have done what I've done in my life and career if I was not, I would say, sometimes overconfident. Mm-hmm. From the beginning, I knew that there is nothing I could not do, because if some other people did it, it means, I can do it as well. The sky is the limit. So I always wanted to be, a physician that gets her postgraduate training in the States, and I did that. That was the first step. Of course, I had to be very confident because when you come here as a foreign medical graduate, you have really to prove yourself. You have to be more superior to the American physicians, the young physicians. You have to read more, you have to be more active, you have to prove yourself. And the first year is the toughest one because that's when all the professors will get the impression about you. And people feel you're confident, you radiate your confidence. I had to I had to show my confidence because I wanted to get the confidence not only of my colleagues or my supervisors, but also of the patients and their families.
Mm-hmm.
Sometimes I was not sure of what I was doing, but nobody knew that I had some doubt. Then going back to Saudi Arabia and practicing medicine there was also not easy. I was one of the very few women that went there, did their postgraduate studies in the States, and came back and practiced in Saudi Arabia. So I had to be very confident. It's a male-dominating environment.
Society. Yes, absolutely.
Yeah. So, in every aspect of my life, I had to show confidence. Inside, sometimes I had doubts if I can do it or not, but I overcome those doubts.
You kept pushing through.
Yes, pushing through, that's the right word. Yes.
Yeah.
And I'm still pushing through till this moment.
I think it's a lifelong journey, because every step of life, every step of the journey, something new unfolds, and you realize that, oh, I didn't learn that, or I didn't know that, and I have to work on this. And I didn't, especially when you come from a different environment and different culture. It's like it's something new every day.
Something new every day. And it's not only professionally, also socially.
Of course.
You are here taking care of your children are in a different culture. You want to teach them some of your culture and some of your background, and on the other hand they're seeing some different things, and you have to be try to be in the middle of the road. So it's a struggle in every aspect, and I think especially women from the Middle East.
Yes, because we are not raised, at least from our generation, we were not raised to be
fighters,
maybe, or fighters. We were always taught to be like, someone else is going to take care of us. Someone is going to drive. Someone else is going to bring the groceries. Someone else is going to do the house chores. Someone else is going to do something.
Very true. Very true. I have maids growing up all my life, drivers. I did not know how to cook.
How to do anything.
How to clean or do grocery shopping. So it was a big shock to my system.
So you come here and you have to do everything. And you don't know, I mean, everything is so controlled of an environment. And here it's a so free environment, and you don't know what to do with all of this freedom and how to really navigate through it. Especially when you have children, because I do remember the same situation when I came here with my little girl. She was like months old. It's pretty struggle. It's a heavy struggle, if you will. So for those who are joining us just now, I am interviewing Dr. Sahar Barayan. She is the medical director of pediatric nephrology and past chief staff at Valley Children's Hospital in California. And this is a temporary, usually a 2 terms position in the hospital. So, in your opinion, what actions or behaviors do you think that a person can do to undermine their own confidence?
Their thoughts. Your thoughts will either make you successful, confident, and go forward, or they will hold you back. Your mind is your worst enemy or your best friend. If you stand in front of the mirror, look at yourself, and shine that confidence. Okay, I can do this. I know I can do it. You'll do it. But if you start shaking and have doubts all the time, it's going to be... I'm so sorry, I get distracted by reading the messages. Hello, everyone. Nice meeting you.
Yes, hello, everyone. I see people. Yeah, hello, Gilmaki. Hello, Nancy, Jose, Yusuf. It's nice. Thank you for tuning in. If you have any question or comment, please feel free to comment on the comment section, and I will address them at the end of the interview. So you're saying that the mindset, and we can be our own friend or our own enemy. in terms of how
Very
we.
true.
But the issue is sometimes if we are not taught, we don't know how to change the mindset, and that can be a challenge. We need to seek that support or help sometimes to be able to achieve it. What do you think of that?
And you have to work on yourself. We're not born with skills. So I did read a lot of personal growth books. For instance, one of my worst nightmares was public speaking.
Yes,
And
the same here.
yeah, I think if you ask people, most of them will rather die than
Oh
speak.
yeah, it's the most fearful thing to people, more than death, actually.
That's very true. So, because of my fear of public speaking, I started reading books. I started, listening to tapes, and every book that I read, it was the whole thing was you have to practice your speech. You have to prepare a draft. You have to practice your speech over and over and over again in front of a mirror. Time yourself and so forth. Not only that, I also joined Toastmasters.
Yeah. I did that also years back.
Right. As Toastmaster, what you do is you meet with a group of people, you all share the same interest, share the same fear of public speaking, you
Yes,
prepare a speech, you present it to the group, and then you get feedback and criticism. So I think that was very, very helpful as well.
So, and what do you think that changes that you need to make in yourself besides reading? What physical things that you need to do, like certain activities that you need to do to boost your confidence, and not only externally, also from within?
Well, you have to do some stuff that you really like. There has to be a balance between life and work. So, for instance, for me, playing the piano is something that I truly like, and it relaxes me. The second thing that I like doing a lot is singing. And when I sing, there's an app on the phone that I'm using all the time. And when you sing and you get all this feedback and you have followers and
You need to
admirers,
tell me about that app.
yeah, it's really life changing. It's a life changing
Wow.
experience. You make lots of friends, and that boosts your self confidence as well. And of course, I think positive feedback from your colleagues, from your supervisors, from your patients helps boosting your confidence.
Yeah, absolutely. So, do you have any success story that you would like to share with us that relates to confidence, whether with you or with your client or patient?
Well, as you can see, all my life was a success story, thank goodness. Especially in my career. I wouldn't talk about the other side.
Well,
But
listen.
I think you can't have everything in life, basically.
Yeah.
But one of the stories that I really remember is a story of a child, a mother who had a previous child that died of a certain genetically transmitted kidney disease.
Mm-hmm.
And she had the second child who was born with the same disease. And she was seen by a pediatric nephrologist, and that pediatric nephrologist told her that there's nothing that could be done for this child, and we should just leave him to die. But her pediatrician decided to send her to me for a second opinion. That was in Saudi Arabia.
Oh,
That was
sorry.
my first patient when I just finished my
Oh,
fellowship.
wow.
I had no resources. I didn't know anything about the health system in Saudi Arabia yet. That was my first patient. So the mom came to me crying with her baby, beautiful baby, and told me, is my child gonna die? Is there anything we can do to make him survive? And I held her hand and I told her, yes, we can do things to make him survive, but you are gonna work so hard with me because this is gonna be a tough road. She said, I'll do everything you tell me to do. So the first thing we had to do was to take his kidneys out because his kidneys were gonna turn into cancer. And that was the thing that was gonna kill him. So at 6 months old, we took the kidneys out. He had to be on dialysis. It was very difficult because I didn't have a dialysis nurse. The adult nurses made a strike against me, and I had to go to the CEO and CMO. I mean, it was a big thing. To make a long story short, this baby was on dialysis for 2 years, had lots of complications, but ended up getting a kidney transplant, and he's in college now.
Wow.
So this is one of the stories that I'll never forget because the mom was devastated. And now she believes in me, and even though she's in Saudi Arabia, we're still in touch. I go and visit them when I go back there, and I'm very proud. I'm very proud.
Wonderful, wonderful. That's an amazing story. That's so your confidence had radiated to the mother, and together with both of your confidence, were able to overcome this huge hurdle in the child's life, and you were able to help him.
Not only the mother, I mean, everybody around me. Physicians were, they didn't believe that we could do that.
Yeah.
Because they didn't think that a 6 months old would survive dialysis. Nurses, uh, I had to, I'm a fighter when I fight for my
So you
patients.
had to
So,
rely on yourself.
yes, and sometimes, like the chief medical officer at that time told me that, we're spending a lot of resources on the child. We should just let go. And I said, no, I'm not letting go. And I'm very happy. I'm very happy I did not
This is a very
listen to.
moving story. Yeah, imagine now hearing that he is in college now, and they
Yes,
were
he's in.
telling him that he's gonna die. Wow.
Yeah, yeah. So this is one of the stories, but this one really touches my heart because the mom was devastated, and I was very heartbroken when I saw her and saw the kid, and I decided that I'll just do everything in my capacity to help them.
Yes, yes. I want to thank people also. They're joining us: Nisha, Noreen, Nancy, Marissa. Uh, Thank you so much for joining us. Again, we are interviewing Dr. Sahar Barayan. She is the Medical Director of Pediatric Nephrology and past Chief of Staff at Valley Children's Hospital in California. So we are interviewing her today on her experience with confidence throughout her professional career and personal life. So again, Sahar, so we go back, how long? Maybe more 20 years ago, me and you.
More than 10 years ago,
In
yes.
Khobar, it's in the eastern province of Saudi Arabia. This was the first time we met over there. And then we continued our friendship here in the US. Although you are in Virginia, California, and I'm here in Pennsylvania, but we always kept in touch. So it's
That's very true. And as they say, you don't have to talk to people every day to be connected.
No, absolutely.
We share great stories. We're very good friends. We
Yeah,
laugh at each other's jokes and stuff on Facebook, but
absolutely.
the connection is always
Absolutely.
there.
Absolutely. So I wanted to ask you, do you have any failure story, and how could you deal with that and not to affect your confidence? Because whenever we have this issue of when we fail, we think we are a failure, and we know as a human being, excuse me, we are not perfect. We do mistakes, and we need to look at them as lessons to move forward and to learn from them and move forward. But sometimes we get stuck. So do you have a story around that when you had unsuccessful event, but you were able to overcome it and work through it and just turn it into a learning experience instead of a devastating event?
Difficult question and sad question because as you know, no one likes to remember their failures.
Of course.
But I think in my opinion, my failure will be if I lose one of my patients. That's a failure. And I remember in 2009, I had a 14-year-old coming to the emergency room. She was sick. She was urinating blood, and nobody knew what was wrong with her. She was going to another hospital, and I admitted her to the hospital. She had kidney failure. Next day, I ran all the tests necessary, and I sent her for an ultrasound. And I told the parents, we're still working to find out what's going on, and tomorrow we'll start dialysis. That same night, I received a call from the hospital at 7 p.m. that she's having severe chest pain and she died, just like that. So I ran to the hospital. It was very traumatic to see the family. And the big question, what did I miss? Why did that happen? And I kept blaming myself. I read every lab, I tried everything. I got another friend to look at my notes. Did I do anything wrong? Did I miss something? And then for 6 weeks, I just could not get over it. Every time I had a patient lying in front of me in the bed, I would question my capabilities. Am I missing something? How can people trust me on their children? Maybe this child is gonna die. And yeah, so it took me 6 weeks to recover. And the thing is, when they did the autopsy on the child, here they do autopsies on all these children with.
Was this here or in Saudi Arabia?
No, that's the States. That's in the States.
Okay.
I mean, this is really one of the. I think this is the only child that I lost suddenly. There are some other children, of course, that are chronically ill, and you know that
You're expecting them to
expect
pass
them to
away.
die. But this one was a sudden death, and it was very traumatic. But then we found out that all her organs were clotted, and nobody knew why, even postmortem exam. And the parents tried to sue me, which I'm not angry at them. I would be doing the same thing if I bring my child to the hospital and the child
And they die. Oh my God.
dies. Yeah, but when their lawyer and the other expert physician looked at everything I did. They did well. She did everything right. There's nothing to sue her about. But I think this was one of the stories that's still hurting me a lot, and it haunts me sometimes. I still remember exactly the date. I remember the time. I remember everything about this case, and I don't think I'll ever get over it. It brings sad feelings every time I talk about it.
So is it because, well, you know that you didn't do anything wrong? Is it because it's not about confidence? It's about just something happened. I mean, this is their situation. Is it sad because it's a sudden death? Was it sad
It's a
because
sudden death, and I was confident of what I was doing. I thought I was doing everything right, but then the child dies, and you question yourself. And we're human beings. I mean, physicians are not machines. We blame ourselves a lot. We have a lot of self-reproach. But you need to pull yourself up again
you need to pull
and
yourself
you
out of it and you continue going, moving
continue
forward?
going and providing the services that you were trained to do, the care that you always give, the love you always give, and keep going.
Absolutely. Absolutely. It's I think how about your personal life? How would you I don't mean like going into your personal detail of your personal life, but living in the US, coming here from Saudi Arabia, handling, studying, being a mother, having two children, acclimating to a new environment, to a new, even though we spoke English back then, but it's not the same when you are in the US.
Very true, very true. And that was another,
yeah,
yeah,
because
another,
over there you will talk like in a British dialect. In America, it doesn't matter. But here, I mean, sometimes you say things and people, especially when you're new, what did you say? I mean, it's like and it gives you like this doubt, second guess yourself, especially in the beginning.
very true. So, from the minute I came to the States, it was a struggle. When I came here for my residency, I was full-term pregnant with my first son. I delivered 10 days after my arrival. And I was a new mother. I had no idea how to take care of a baby. Not only that, I'm in a new country. I'm trying to struggle to get an apartment, to get furniture. I don't know how to take care of the baby. And I was personally, physically sick. And thank goodness my mom came and, she helped me a lot. But still, it was not only that. I'm a new mother. I started residency 6 weeks later.
Wow.
And as you said, it's a different culture, it's a different language. People
Everything
look at
is
you
different. Yeah, everything
Yeah.
is different. Yeah.
Yeah. So it was a struggle. And then I got pregnant with my second child. With my second child, I was determined that, of course, it was a surprise, and I was not prepared to have a child, but I didn't want to fail. So I was full term. I worked till the last minute.
Wow.
I went to the hospital, and the next day I went for induction.
Yeah.
And I went back to work after 2 weeks of having the baby.
Wow.
Yeah. It was very tough, but I had to prove to everyone that I can do it. Just being
Well,
a
you want to
woman.
prove it to yourself first that you can do it, and you want to, capitalize on that confidence and keep going. Because if we
Keep
stop, it's like we have to keep going. We cannot stop. Yeah, to keep pushing.
And then Rabab, you are working in the hospital. I'm on call for 36 hours every 3 days, and I have a lot of guilt about my children. So I come home, I didn't sleep for 36 hours, but I take the children, both of them, they were 15 months apart, and I take them to Chuck E. Cheese, and
You
take
have
them
to be a mom. Yeah, you cannot just
I
say,
have
"Oh,
to.
wait a second, I need to rest."
Yeah, I
Because
have
they're
one.
waiting for you. They're waiting for you. Yeah.
I have one on my shoulder, and I have one. I'm carrying him in a carrier,
Yeah.
and I'm going in the slides. I'm playing with the balls. Yeah, so it was tough. And, nowadays, when I look back at these days, I feel sorry for myself. I think I was doing a lot, but in my
But look
20s,
at
I was,
you now. But look at you. So it's all paid off after all of this struggle. After it increases our sense of self. We know that we can push ourselves beyond our what we see
limit,
we're capable of,
right?
and yeah, absolutely.
And then, when I came back the second time to the States, the kids were in school when I went to for my fellowship. So you drive them to school, you pick them up from school, then you help them with the
Absolutely.
homework, and you go, And then when I moved back to the States in 2004, they were teenagers. So it was
Oh, it was
very, very,
another hurdle to overcome.
yes, especially
Yes.
when you're a physician now practicing in the States and you have to attract patients, you have to get referrals from other physicians. So
You have
it
to
was,
work hard on that, and in
yeah,
addition to your responsibility at home, that's you need to find this delicate balance, if you will, between the professional demands and the house
personally,
demands, personal demands, and also taking care of yourself, because sometimes we get sucked in between this and that, and we forget about ourselves. But we need
that's it.
always to keep that confidence up, and we need to use it for our own benefits, not only professionally but also in our personal life, and personally for our own self. Again, in this series, this is I am interviewing Dr. Sahar Barayan. She is the medical director of pediatric nephrology and past chief of staff at Valley Children's Hospital in California. I want to ask you, what are your future plans?
Okay, so Rabab,
Yeah,
when I always wanted to be in a leadership position.
yeah.
So I love my clinical work,
Hmm.
but I think I can do more in other aspects.
Yes.
So I did my master's degree in medical management,
Hmm.
and I am aspiring to be a chief medical officer,
Okay.
not a CEO, because when you're a CEO, you have to look at the financial
The budget and
medicine.
yeah,
Yeah,
yeah.
and I don't want to be involved with finances. I have a very weak heart. I cannot mix medicine with money.
Mhm.
So I just want to take care of the patients, the quality, the services, interact with the different sections of the hospitals. That's what I am aspiring for, and that's my next step. So I see myself in the next 5 years as a chief medical officer, and that should be my retirement job. I want to retire.
Oh wow. Yeah, and I have no doubt you will get there. I have no doubt.
Yeah, the problem is, finding a place, because the city where I'm in is a very small city. So if I want to get a position, I'm gonna have to move from here.
Okay. So you want to meet, you have to move from the city in California to another city.
Yes, because in Fresno we have very very few hospitals, not many opportunities. So I'll have to make a big move, and a big move may mean going back home to Saudi Arabia.
Oh, wow.
Mhm.
That's wow. That's a surprise. Yeah. Well,
Well, it's about
I know
time.
there are a lot of changes back in Saudi Arabia now, but that's a big leap. That's a big move to think about, Sahar.
Well, I've been in the States for almost 21 years,
Okay.
back and forth. And, you get into a stage in your life where you really want to be closer to your family.
I see.
And I think I'm at this stage right now.
So you want to go back?
I want to go back. Yes. Oh
Wow.
my God. I hope nobody is watching from my hospital.
Well, I think they might. So now you're telling everyone. Well, we're approaching the end of the interview, and I want to ask you, how can the audience reach you if they would like to contact you?
Well, I don't know if my name is showing, but I mean, they
Yeah.
can befriend me if they want. As I told you, I'm getting a lot of friend requests.
Okay. Okay.
The
You
data,
can,
I
you
think.
can also, if you would like to, after this, you can add your email on the if you would like, on the comments, so if people would like to reach you, if that's up to you, of course, if you would like to leave
Okay. Mhm.
and after the live. So at the end of the live, I want to ask you, what is your advice or tip to the audience about confidence and how to utilize that in their lives, professional and their personal life, in order to succeed?
Well, as I've said before, confidence radiates from within. Okay. So first of all, you're gonna have to have the skills and the education to be able to perform what you want to do. And then you're gonna have to have positive thoughts, and you have to carry yourself in such a way that people will trust you and gain your confidence. That's my simple advice.
Thank you so much, Dr. Sahar Barayan, for joining us in this live. I really appreciate it, and I wish you the best of luck in your endeavor, and we'll stay in touch.
Thank
And
you.
thank you. Thank you
And
so
thank
much.
you. Thank
Thank
you.
you so much. Thank you everyone who joined us. I don't see any. Let's see if there are any questions. I don't see questions in the comments, but there are a lot of people joined us and thanking you, Sahar, for sharing your experience. So I thank all the audience for sharing and for their lovely comments. I truly appreciate it. So until I see you tomorrow, I have another episode with Jennifer Osgar, and she is a teacher and educator. I will have another interview tomorrow at 7 p.m. Eastern Time. Thank you so much again, Sahar. It was lovely to hear from you and for you to join us in our live. Thank you. Appreciate it. Have a wonderful evening.
Thank you. And I love you too, Terry. Thank you very much for the nice words.
Thank you.
Okay.
Have
Thank
a
you.
good
Bye-bye.
night. Thank you.
You too. Bye bye.
Thank you. Bye bye.